Ladies and gentlemen, thank you for standing by and welcome to COVID-19 media briefing. At this time, all participants are in a listen-only mode. After the speaker's presentation, there will be a question and answer session. To ask a question during the session, you will need to press star 1 on your telephone keypad. Thank you. I would now like to hand the conference over to your first speaker today, Mr. Teddy DeShawn. Sir, the floor is yours.
Thank you, and good afternoon. Thank you for joining the call today. On with us, we have Minnesota Department of Health Commissioner Jan Malcolm, the Director of the University of Minnesota's Center for Infectious Disease Research and Policy, as well as a newly appointed member of President-elect Joe Biden's COVID-19 Advisory Task Force, Dr. Michael Osterholm, and Minnesota Governor Tim Walz. I would just like to remind reporters to please limit yourself to one question each, just so we can ensure we get to as many questions from as many different media outlets as possible. And with that, I'll hand it over to Governor Tim Walz.
Thank you, Teddy, and good afternoon, Minnesota. Thank you for tuning in. We're joined today, as you heard Teddy say, by two people you'd find hard-pressed better suited for the situation we're in, Commissioner Jan Malcolm and, of course, Dr. Osterholm. So I'm glad they're both here. We spent quite a bit of time on Tuesday as we laid out the situation where the COVID-19 pandemic was burning through the upper Midwest, and Minnesota's no exception. We laid out the data that we were looking at that's driving some of the decisions on mitigation and ways that we can ensure that we slow this spread to not overwhelm both our hospital systems, our workforce, and be able to make sure that those things that we want to keep open, whether they be schools or businesses, that see if we have the capacity to do that. And unfortunately, this frightening trajectory, and it's all too predictable that since Tuesday, the situation has gotten worse. And that is inevitable in terms of where the virus is. It is not inevitable if we take the actions to change that. I myself spent a better part of the morning with researchers from the Mayo Clinic and statisticians as we looked at some of the numbers. We know how many hospital beds we have. We're starting to get a pretty good sight picture on our workforce, but that workforce issue changes very dramatically as these types of numbers that you see skyrocketing. They will inevitably end up hitting those healthcare workers, which will then have that cascading effect of making it more difficult to get the care of people who need it. So I'm just want to hit on a few things, and I think for Minnesotans it's very challenging right now, and I want to acknowledge that emotionally this is getting very hard. We've lost 248 Minnesotans over the last 7 days. We had 7,200 new cases yesterday, which are records we never want to break. We also passed over 200,000 cases that have been reported since the beginning of the pandemic. We lost 56 Minnesotans yesterday alone. And Lieutenant Governor often says this. Of course, she lost her older brother early in the pandemic to COVID-19. Every single one of those people was somebody's someone. And I think we need to take that too hard. And just to get an idea of, and you'll hear from Dr. Osterholm and, of course, Commissioner Malcolm about the predictability of this if we don't take the necessary steps that we know are backed by the science and backed by the data to slow this. It took us about 7 months, 27 weeks to reach 100,000 cases in Minnesota. It took 7 weeks, a little short of 2 months, to reach 100,000, to reach 200,000, add the next 100,000. It will take us less than 3 weeks to reach 300,000. This trajectory is the way things happen. That means more people are hospitalized. The spread is exponentially greater, and the risk to all of us increase greatly. That is placing an incredibly heavy burden on hospital and healthcare workers. It makes it very, very difficult to strains all of our systems, including schools and including businesses. So this was never, and I hope that it's been made clear, this was never a choice between keeping schools or the economy open or fighting the pandemic. You cannot keep the economy open, and you cannot get students and educators safely back into schools if you do not use the science to fight COVID-19. So it is more imperative than ever, Minnesotans. I said it with no pleasure that we were headed towards a deep, dark winter. There were those that would make the case that it was over this summer. Certainly not Commissioner Malcolm or Dr. Osterholm, who were making it very clear, and I was taking their advice, that November would be a very difficult time. And unfortunately, they were exactly right. So here's where we stand, Minnesotans. We know that wearing masks, social distancing, washing your hands, and avoiding large gatherings makes a difference. We also know who is most vulnerable to this. Asymptomatic 18 to 35-year-olds are vulnerable in the sense that they spread this. We know those with underlying health conditions and the elderly are much more susceptible to the long-term effect. But it doesn't mean, I believe Commissioner Malcolm told me we lost a 21-year-old with no underlying health conditions today in that death total. We made some moves. This is frustrating for everyone. We made moves starting tonight at 10 p.m. We will be stopping the serving of alcohol and food at those locations. I have to tell you, I, like everyone else, look at social media and I see pictures that come up. If we're going to beat this thing, now is the time. If Dr. Ostrom uses baseball analogies, I'll use my football analogy. If we're at halftime here, it is time to suck it up and get through this, because there is light at the end of the tunnel. There is the potential to do this. We know that every day that we get closer to a vaccine is one more day that we can fight this thing through and bring more people with us. We're waiting for that day, but until it becomes available, we have got to do this right. I can tell you that it is now easier than ever to get a test in Minnesota. We surpassed 50,000 tests. Early in this pandemic, there was the belief it would be very difficult to get 5,000 tests. But these tests, whether they're access, they're cost-free, they're barrier-free, they're pain-free, now you can get them at your home and have them back in 2 weeks. But here's the thing. If you don't use that test and we don't follow the recommendations and we don't contact trace and then isolate, that doesn't get us to where we need to go. So Minnesotans, we're here. I will defer to my health experts who are going to come on, but in talking to the folks at the Mayo Clinic, we have 4 states around us that surpassed 150 cases per 100,000. Minnesotans at about 120. We look at the projections and what happens if we, and I think it seems unless we make these changes, we will get to that 150. The one thing that I think bothered these health professionals, statisticians, and researchers was we have not seen those numbers anywhere on the planet throughout this whole pandemic. And some of the projections show that reaching potentially in North Dakota up to 200 or above. And what you can start to gain from that is you can extrapolate how many healthcare workers are going to get sick, how many hospital beds are going to be used. And even with the therapeutics and the work we've done, a huge growth in the loss of lives, and then, of course, the unknowns of what happens with long-term health complications from a novel coronavirus that we don't understand everything about at this time. So, Minnesotans, it's not a lot of good news other than we can control our destiny in this. We can choose to make those choices around masking. We can choose to believe this is real and quit playing that this is somehow not, is like the flu or something. None of those things were true at the beginning. None of those things are true now. And so I would ask you all, it's going to be a little bumpy for a few weeks, but we owe it to our neighbors. We owe it to the healthcare workers. We owe it to the teachers. We owe it to our children to do the things we know that can slow this thing down, that can make a difference, and can start to get through to the other side of this. With that, I'd like to turn it to Minnesota Department of Health Commissioner Jan Malcolm.
Governor, thank you so much for joining us today. Good afternoon. Around the world this morning, we're now over 52.8 million cases, and this is kind of stunning, up almost 600,000 since yesterday. Over 1.29 million deaths around the world, 8,860 more people in the last day. In the United States, we're now above 10.5 million cases. Again, a stunning daily increase of 153,000 more cases just since yesterday. And we're now over 242,000 deaths in the United States. 628 additional Americans died yesterday. Here in Minnesota, as the governor has said, we added another 5,552 new cases. So we've been averaging over 6,000 for the last many days now, for a new total of 207,339 cases. And we are seeing, as the governor has just detailed for you, an incredibly steep rate of increase. Our new case numbers have doubled in the last week, day by day. And Minnesota lost another 46 people to COVID yesterday, as the governor shared, for a new total of 2,802 deaths since the start of the pandemic. 13 of these deaths reported yesterday, were in the metropolitan area, 33 in greater Minnesota. These included not only many persons over age 70, but younger as well, including, as the governor said, one person in their 20s with no known underlying health conditions. 34 of the deaths reported yesterday occurred in residents of long-term care facilities. And this past week, this current week that we're in, has been the deadliest so far. COVID-19 has claimed more Minnesotans this week than in any other week so far. And the hospitalization situation is very tight as well. There are currently 1,424 people in Minnesota hospitals with COVID-19. Of those, 293 are in intensive care, both high water marks. On the testing front, yesterday's 5,552 confirmed cases came on our highest volume yet of tests. 51,241 lab tests processed yesterday. Results came in yesterday. This is by far the highest volume of tests reported in a 24-hour period, and first time we've been over 50,000. But yet, even with that big and steady continued increases in test volume, cases are going up faster than testing. And we talk a lot about our 7-day average testing positivity rate being a critical measure of whether we're keeping pace with the virus in our testing. And that 7-day average testing positivity rate is now up to 13.1%. It's up from 9.8% just a week ago. Now, we spend a lot of time talking about numbers on these calls, and that can be a problem because we can tend to lose sight of the faces and the people and the human meaning behind all those numbers. There are a lot of things about COVID-19 you can't understand just by looking at the data, as important as those data are to take seriously. One of those things is that the really significant long-term health consequences that COVID-19 cases can have. I want to share with permission a communication that was sent to me just last week by a Minnesota physician, Dr. Sarah Whitehouse. Dr. Whitehouse wants to be working to help meet the surging demand for care of COVID patients. Unfortunately, she's been unable to work for the last 6 months because of long-term effects of a viral illness that she had this spring that affected her heart and her vocal cords. She actually had a negative COVID test early on, but based on her clinical knowledge and what's been learned in recent months, she is quite certain that she did in fact have COVID and is still slowly recovering from it. Her motivation for writing was actually to ask the governor for some of the from the actions that he took on Tuesday to help slow down the spread of COVID. She, as she put it, she and all of our neighbors, family, and friends deserve the type of health care that Minnesota has prided itself on for decades to be available to them as this crisis deepens. And she said that we, from her perspective, we need our excellent healthcare system to be available to us more than we need some of the regular life amenities that we so enjoy during normal times. And she certainly wasn't dismissing those things, those social opportunities, sports and other things, as unimportant. But she was making the point that if people can't get critically needed health care, those other activities, as important as they are, fade into the background when it's you or your family member suffering from a serious condition that needs serious treatment, whether that be COVID or other important health care conditions. And she concluded by reminding me, as she should, that the daily death counts and hospitalization rates and test positivity rates don't even count those many, many people who have been left with serious health conditions and even permanent disabilities potentially in the wake of this illness. And though Dr. Whitehouse was never counted in the official numbers back in May, she wants to be heard now. And I thank her for giving me permission to share her story with you so that that folks can also think about the people who aren't reflected in these numbers, the many more people in our community who've been left with serious illness, and for her reminder of where we might be heading if we don't take the governor's admonitions to take this power into our own hands right now. So thank you, Dr. Whitehouse, for speaking up, and I want to thank all of our colleagues in healthcare for their continued service day after day after day, even as their exhaustion and, frankly, their frustration grows day by day. A quick word on the importance of not only testing but follow-up on testing, as the governor was mentioning. Since the beginning of this pandemic, we've had critical goals around case investigation and contact tracing. The goal is to contact people who have COVID, who have positive diagnoses of COVID-19, or who were exposed to people who have tested positive for COVID-19, and help people isolate themselves to prevent spreading the virus further and educating people on reducing their risk. Each case that successfully isolates and quarantines can prevent dozens of people from contracting the disease. Beginning Monday, we're going to start a new program to send text messages by phone to cases and contacts of COVID-19 cases before we call them. The idea is to more effectively reach and inform those who test positive for COVID-19 and their close contacts about what they need to do to prevent further spread and to better protect the state's most vulnerable populations through improved outreach and communication. Now, we do think that this change, texting people before we call them, will hopefully help to lower the number of calls that we need to make to each case or each contact in our attempt to reach them. We hope that the text will alert people to the fact that we will be calling and to encourage that primary case or their contacts to answer that call or to return that call. We've seen from colleagues in other states and some of our local health department colleagues who've been using this text feature that it does, in fact, make people more likely to answer the call and reduces the number of repeated calls made by public health workers to folks who aren't picking up. This also, we hope, is helpful in combating any potential phone scams by those who may be attempting to impersonate public health workers. And this texting program will alert those that we're trying to get in touch with that they're going to be receiving a call and what phone number it will arrive from. And as I mentioned, a number of our local public health departments around the state have already implemented this kind of a program to help with outreach and case investigation. So again, a text message is going to be sent to people who are identified as a positive case or the contact of a positive case to let them know that a case interviewer from either the state, local, or tribal health departments will be calling to discuss their COVID-19 test results or potential exposures. And that phone number in the text will be specific depending upon the region of the state the person is in, and will help people know what number to look for so that more calls get answered more quickly, more interviews get completed more quickly, and more people can take the appropriate action to isolate and quarantine to help break the chains of transmission. And with that, it's my great pleasure to hand the call over to my longtime colleague and friend, Dr. Michael Osterholm.
Well, thank you very much, Commissioner, and thank you, Governor, for having me on here. I want to just offer my full support to the comments both of you made today, and just to add some additional context. Also, I just want to make note that while I was introduced as part of the Biden task force, I speak for myself here today, and obviously not on behalf of the task force. Let me just say that 4 weeks ago, when I was on Meet the Press, I made the statement that we were entering the darkest days of this pandemic. I wish I could only be back there again. Just to remind people, the week after Labor Day, we were at 25,000 cases a day in this country. Today, we're reporting out 163,405 cases, almost 100,000 cases more than the previous case report for the peak in July. You can see how the numbers have changed substantially since that time. As the governor noted, we're in a period now of exponential growth, a period where we could expect to see these cases go much higher than they are today. And I would just, my best professional judgment is that we could easily be well into the mid to high 200,000s of cases a day, literally within the next month if there aren't changes made. We already are challenged substantially in this country in terms of our healthcare systems. I can't lay that out more clearly than to refer you to a video that is available of Representative Elise Mann's presentation to the legislature yesterday. As you know, Representative Mann is a physician who talked about her own experience and what's happening right now with this. I urge you all to go listen to this. It was a remarkable and honest evaluation where we're at. Our healthcare systems are literally being overrun, and as these numbers continue to increase, I just want to first of all thank the very, very brave men and women who are providing the kind of care in our healthcare systems every day in the state. But there is a limit to which we can expect them to go, and I'm afraid we will exceed that if we don't take very seriously what the governor has stated what we must do. Not only, Governor, do I support your actions, but as you know, I will continue to be an advocate for even more because I see what's coming down the pike here. We are in uncharted territories. What I was thinking about the comments here today, I reminded of a discussion I had with John Barry, the historian, the famous chronicler of the 1918 pandemic, and he and I were just talking this morning. The entire outbreak for 1918 in cities occurred usually within 6 to 10 weeks from start to finish. We are now in our 9th month, and frankly, the next 8 to 10 weeks will define a great deal of what that's going to mean. In terms of where we're going, I think the important message is to understand this is our COVID year. This is not going to be like last year, whether it be the holidays, whether it be everyday life, and it hopefully will not be like what it's going to be next year. What we're trying to hold out here and what we're trying to tell the story is that, in fact, this is not something we want to continue to do to try to prevent this transmission of this virus in the ways in which we have to do it now. But, in fact, with the advent of a vaccine and the availability of that vaccine, I believe, starting in the first quarter of next year, if we can just hold out until then, we can save so many lives, so much suffering. And so our efforts are not for a long-term, do this forever kind of approach. It's to give us the time to get to vaccines. And I believe we will have safe and effective vaccines in that time period. So we're asking all Minnesotans to do that, not just for themselves, but for each other. Our healthcare systems all are for each of us. And if we are overwhelming those systems, we all suffer. So I just want to, again, Governor, thank you for your leadership. Commissioner Malcolm, I can't say enough about the Minnesota Department of Health staff and all the work that they do and how well they do it. We're all, as citizens of Minnesota, so fortunate to live in this state under your leadership. And with that, Governor, I'll turn it back over to you and just thank you. And please, Minnesotans, listen to what we're saying.
Well, thank you, Dr. Osterholm, and I would reiterate how grateful and lucky we are in Minnesota to have your leadership and guidance. These are the people that I am listening to, from Dr. Osterholm to Commissioner Malcolm to the Mayo Clinic, and listening to those businesses and school leaders. This is simply reality. This is science. This is where the virus is at. And I think Dr. Osterholm has been correct, along with Commissioner Malcolm, on the projected trajectory of this. We, meaning Minnesotans, have made sacrifices and changed that trajectory through mitigation and through our actions. And it has been better at times, and it has gone down some. Now is the time. And I think this idea of the light at the end of the tunnel, it's not wishful thinking. And I want Minnesotans to know that a lot of thought has been put into what will distribution of a vaccine look like? What are all the, this is not as easy as just going down even as getting a flu shot, which we don't do in as big a numbers as we should. We're going to have to start prepping for that. That work is being done. But until we get there, the only way we protect our neighbors, that precious healthcare workforce, and I appreciate Dr. Ostrom highlighting Dr. Mann's clear assessment. We've got leaders in the Minnesota House and Senate who are working to make sure that we have the tools necessary to get this done. So with that, I would open it up to questions to any of the panelists.
Thank you, Governor. Ladies and gentlemen, if you would like to ask a question, you may press star 1 on your telephone keypad. Once again, you may press star 1 to ask a question. And as a reminder, please limit your question to 1. Please stand by while we compile the Q&A roster. Your first question comes from the line of Catherine Wickert from Minnesota Public Radio. Your line is open.
Hi. This question is for Governor Walz as well as Dr. Osterholm. I'm hoping you could both comment on, given where we are now, if the state was too slow to order a mask mandate and too quick to open up in June.
Yeah, I'll take that first, Mike. I think in retrospect, certainly I go back and do after action reports on everything we do, and I've said it. I think that I think moving on a mask mandate sooner would have helped. As far as the opening up, this is a really striking a balance of where the tolerance is for folks and what we can get done. I will own the decisions that they get made here, and I do them based on the data, the science, and the social implications of what we can get done. I will, though, continue to say the inability to have a national coordinated strategy and having 50 states operate differently really impedes and does impact some of these decisions. So I think, yes, I would have rather gone mass a little earlier. The information is much clearer now, but I think we were having it and had that debate. I'm glad we did move on it. And as far as the opening up of it, I just think it was inevitable. Again, my mandate is not what's going to keep people home. My mandate of 10 people at Thanksgiving is not what's going to stop people from gathering in large numbers and spreading this. It's going to be the will of the public. So, Mike, I will turn it to you for a candid and honest assessment of that.
Well, thank you very much, Governor. Let me just say at the outset that we all want to try to do something about this issue, and we're struggling to find the ways to do it. And it's very hard to ask many Minnesota citizens who themselves are struggling, whether it be in their personal life, financially, whether they're going to have a roof over their head, whether they're going to be able to put food on the table for their 2 children, whether they're a small business owner who is struggling just to make it. And one of the things that we've been confronted with is an absence of leadership right now that has provided the kind of federal support that we need. And I just want to urge that all of us, and I had conversations with 4 governors in the last day who have contacted me about how can we better organize a national response that is coordinated among the 50 states and also provides the kind of support that will make it possible for us to open up schools again, because we're controlling the transmission in our communities, which then allow people to work from home in a more efficient manner or go back to work. Whether we're going to keep the various small businesses and medium-sized businesses afloat. And so I just want to say that I think that part of the equation is something we can't solve in Minnesota, but we surely can advocate on a national level for that kind of support. And I just want to reiterate what the governor just said. We need national standards. One of the problems we have right now is we've got 50 governors who all have been left to their own to come up with the recommendations for what to do. I feel very confident that our governor is making the very best of recommendations of what can be done. But at the same time, I just want to say, whether it's mask mandates, it's whatever, we need a national standard, and that has contributed to the confusion of not having that kind of national standard.
Okay, and just a quick follow-up. You guys have expanded testing a great deal in the last couple of weeks, and I expect that a lot of people preparing for Thanksgiving might start to get tested sort of proactively next week. Is the state at all concerned about, just a lot of people getting tested at once? Do we have the capacity to handle that?
Yeah, I believe we do. I think maybe I'll leave it to the 2 health professionals on this, because what I don't want to do is set up a situation where people feel like they go in and get a test. They're in that period where it's not showing up. They might get a negative. It is helpful to use this, but you have to know how we use them. But I think the answer is yes. And again, Dr. Ostrom's point on this is we've created 50 different states on testing. We're still short testing across this country. We're still short on PPE across this country. We haven't used the Defense Production Act appropriately. I feel fairly confident that we have those tests. I just hope they're used correctly.
And if I could add one context to that, and I'm speaking for myself again, I think that we just have to remind ourselves again, this is our COVID year. And I have been involved with too many situations where young, healthy adults or others have come home for one or more celebrations, birthdays, whatever, have transmitted the virus in the home, and only to find that several weeks later, Grandpa and Grandma, or Mom and Dad, or Uncle Bill and Aunt Jane are dead. If we really want to be serious this year about loving and protecting our families, we will think about the holiday get-togethers. As much as we want them, we need them emotionally. We all emotionally need that right now. But is this our gift to each other, to love each other so much this year? If you can't bubble yourself, if you can't, in the 10 days before you're going to come home or the 14 days, make certain that you're not exposed and that you would bring this virus home, that you would find alternative ways to celebrate Thanksgiving, whether it's through virtual Thanksgivings, whether it's, even some distance, even spending the day calling all of the people you know that you should have called a long time ago and telling them you're so thankful they were born. But it's one of those days where please don't feel like you have to be pressured into getting together for holidays and then creating the crisis. So if you can do it safely, do it. And I know that my position is not a standard position held by everyone, but I just know that there are going to be far too many tragic situations that will evolve out of these holidays. And this is the year to think about the ultimate love for your family is to protect them, however you need to do that.
Thank you. Your next question comes from the line of Steve Karnowski from Associated Press. Your line is open.
Yeah, hi. Thanks for taking my call. This is Steve Karnowski with AP. I'm just wondering, Governor and Dr. Ostrom, you're painting a pretty dire picture here. Why not order stricter measures like a statewide lockdown?
Yeah, and I think this is a healthy discussion that happens, and Mike will speak for his position, again, continuing to ask for many of those things. I think we look at the numbers and try and adjust. We've gotten a little, I think, better at understanding who's getting this, where they're getting it, and when they're getting it. You saw that happen. And it's the tolerance of what people will and will not do. My hope is, and what we've seen in all of the modeling, I keep asking, why does this eventually peak and come down the other side? And some of the statisticians tell me it's because it gets so horrific, people finally believe it's real. And so I think, again, we will continue to monitor that. There may very well be more changes in mitigation measures that have to be taken if we're seeing where these hotspots are. But Dr. Ostrom and I had very good conversations early on about how long could you keep people, in a virtual stay-at-home situation. How long would they do it and how long would they stick with it? I think from a purely, epidemiological perspective, it would make sense and would have the biggest effect if you could do that. I just think from a social psychology perspective, in how divided we are and how controversial this is for some people, it makes it very difficult. But Mike, I'll let you talk about that because I still think that we'll continue to monitor, and I think more changes will probably have to happen on that dial.
Well, thank you, Governor. I think you've said it very, very well. I mean, there is reality and there is the ideal. In the ideal world right now, we would all try to limit all the contact we have for the immediate weeks and try to break the back of this. That's not realistic. And I think that what the governor is telling us here is exactly what I come to understand, that, in fact, we can't let perfect be the enemy of good. And I surely want to strive for perfect, and I'll keep trying to get there because I know it'll save lives. But I think this is good, and we have to do is just keep pushing this as far as we can. And unfortunately, as we all know, if our own loved ones begin to die from this, that'll surely have an impact on us. And we don't want to get there that way. But at this point, I think we've got what we can get, and we'll just keep trying to get more in terms of preventing more transmission. I also want to come back to the fact that I, again, am so empathetic to those who are suffering financially because of the kinds of things that we're asking people to do. And I just beg that we have our federal leadership that can help provide the kinds of resources that can minimize that impact, which I think then will make it easier for all of us to try to promote the other types of activities we can that might slow down transmission.
Thank you. Your next question comes from the line of Bill Werner from Minnesota News Network. Your line is open.
Hi, yes, thank you for taking the question. Governor, I want to ask you about hospital capacity because you and Director Kelly have some areas identified where you can put up hospital beds, ICU beds, and various other facilities within 24, 72 hours. But my question is, with the increase in spread among healthcare workers, can you expand Minnesota's hospital capacity beyond what the hospitals have already done with these facilities? And even beyond that, you have said that Minnesotans will be able to get the care that they need. Is your confidence level, I'm talking about hospital care, is your confidence level as high in that now as it was a week or two ago, or are you having some concerns about that?
Well, it would be disingenuous to tell you I don't have concerns. As I said, we are in uncharted waters in the pandemic, not just nationally but globally in these. You have hit on a very important point, Bill, that I think has become people have become more aware of. It's one thing to have the physical bed. It's one thing to have the PPE or the ventilator. It's quite another to have a certified RN in that position. And that issue around healthcare workers, and as this spreads, they are obviously going to be put more at risk. We are now starting, and the data that we were looking at with Mayo Clinic, they're providing to their leadership is projections on healthcare workers of their total workforce. How many do we have out today at the current rates? How many will be out on the 1st of December and so forth? And so it is a concern. I am still confident that Minnesotans can get the care, that we can cross-level, we can get them what they need. But again, it would be reckless of me not to look to what's happened in North Dakota and other places of where they've ended up. That's the most frustrating part, I think, in all of this, of some folks' inability to follow the data and project what was coming and to plan accordingly when it seemed like it was fine. I think one of the things that makes this even more challenging, when New York and the Northeast had their spike, we were able to move federal health, public health nurses, and even people volunteered from Minnesota. Many of our nurses went to New York to help them out and then came back home. There is no cavalry out there, if you will, because there was not a national strategy, and each state needs to do this. The good news is we coordinate as well in this state amongst healthcare systems as any in the country. Our ability to cross-level and to move people and both patients and workers, I feel confident puts us in a place to be able to do this. But yes, I will tell you, Bill, that every day this continues to go up, and every day these numbers reach where they're at worries me. And when I look at those projections, they come with a confidence interval in a percentile. If we can keep that to the middle percentile, we will manage where we set and we created. But if you start pressing and ended up on the outlier or the top end of that, which maybe is a small percentage of that could happen, it's still a probability that could happen. And that's the one that makes me nervous. So Jan or Mike, I'll let you comment on this, because it's good that the public understands this. This is the exact right question. It's not good enough just to have the bed space. You need the workforce.
Yeah, thanks, Governor. This is Jan. And I think it's exactly the right thing to be talking about. And that is something that has changed. And I will just say what has really raised the alarm bells in the last week or so has just been the rate of increase. And the governor's completely right that we were projecting, and Mike and others have been, as well as our colleagues at the health department, have been projecting that we could get to these levels, but we're getting there a lot faster, a lot earlier in the season than what we frankly had expected. So it's the rate of increase that has really changed the picture, and the fact that there is so much community spread. We've talked about that a lot too. Just the fact that the exposures are happening in such widespread ways, and the people who are transmitting the virus that don't know that they're infectious, and just those hundreds and thousands of decisions that are being made every day that are helping to fuel this thing, and the quantifiable way that is affecting large numbers of healthcare worker illnesses that is not something we had a precise forecast for, but we're certainly seeing it. So you're right to ask the question. I'm glad the governor reinforced, the degree of cooperation that's going on across hour by hour, not just day by day, across our health systems. But the absolute limit on human capacity is what is the real challenge now, and why it's so urgent that we do everything we can to slow down the rate of spread through these decisions that we have the ability to make.
And if I could just add that one of the things that we obviously have to be aware of and concerned about is what happens over time. The healthcare workers in our state and throughout the country are nothing short of heroes. They are working incredible hours under the most stressful of situations, where they go take a moment to break down and come back into that unit to go back at it again. And one of the concerns that I have is that people have to understand that the next 3 weeks of cases in terms of hospitalizations and deaths are already into the system. They're already going to happen. The virus has already been transmitted. What we do after that can have a big impact by what we do today. And I worry very much about the fact that healthcare workers, we've asked them to run 3 marathons today, and then we asked them to run 3 marathons tomorrow and the next day. At some point, they can't continue to run those marathons. They are just simply mentally and physically exhausted. And we have to understand that's why this is also such a critical issue. We're asking these expert staff, and you just can't go and make an intensivist overnight. It doesn't happen. Is that we also need to preserve these people for the months ahead, because this is not going to get over with tomorrow. We surely have the light at the end of the tunnel for first quarter of next year for vaccine, but between now and then, we've got to make sure that we have a system that also continues to preserve the quality and the number of healthcare workers that we have.
Mike, thanks. Hey, Teddy, if we run a little long today, we're taking a little longer on the answers, but I think it's really important and the chance to have Dr. Ostrom here with us. I think it's a really good point, Bill, too, that you bring up. If we stopped all infections and went down to 0 today, and we reported 0 in new infections tomorrow, that's not going to change what's going to happen in the hospitals over the next 3 weeks. That's what Dr. Ostrom is saying. And what gets really frustrating, and I heard this happen with our mask mandate and some of that tonight at 10 p.m. when the bars stop, and tomorrow and Sunday and Monday when I report cases are going up, people are going to say, well, that didn't work. That shutting the bars down didn't work. I think people need to wrap their mind around this lag time that's built in. It is terrifying to me to think about this, and please correct me, health experts, if I'm wrong. None of that would change the trajectory of what's going to happen with this, even if we went to 0 tomorrow, which is obviously not going to happen because we are still growing.
You nailed it. That's exactly it.
Thank you.
Thank you. Your next question comes from the line of Brian Baxt from Minnesota Public Radio. Your line is open.
Hi, Governor. Your state alcohol inspectors visited about 1,300 establishments between late June and early October, and they found about 400 violations, but they issued no fines. Will you be urging them and their local counterparts to be more vigilant as your new restrictions kick in? And if not, are you worried about businesses ignoring them if they don't see a real consequence or threat to violation?
Yeah, this is one that, Brian, thank you for the question, and I think this has been a real challenge in this. I never want to fine anybody on this. I think Mike and Jan continue to reiterate the pain that this causes economically, and then that leads to potential for a family disruption and all the mental health and physical health things that come out of it. It's very, very difficult. So the vast majority of these establishments are doing the best they can. The problem with restaurants and bars is it's absolutely the worst environment in a pandemic that is spread by aerosol of people in close contact with one another. And so, I got to be honest with you, Brian. I don't know at this point in time, seeing the deaths and seeing the numbers and seeing the catastrophe around it, if you're going to violate this, I don't think the fine holds you back. I'm going to ask them to continue to be vigilant. We're going to continue to enforce, but I don't have enough people. What I need Minnesotans to do is, this is not a political statement. It is not, you can disagree fully politically with someone, but this is the science behind it. So I'm asking them to stay vigilant, to help folks, to be there as a source. Again, what ends up happening if we issue a fine, it ends up people dig in. And I'm just, be candid with you on this. I just need folks to do this. I mean, most people don't need statutes to have them not assault their neighbors. Those who do, you do need to enforce it. But in this case, this is just simply putting people at risk. I need folks to follow along and get us through this.
And Governor, you over the past couple of days, you've mentioned these high death toll numbers. How often do you personally console the families of people who have had a loved one die from COVID?
Yeah, it happens, and it happens mostly randomly, Brian, I'll tell you. And it's happened in front of my house, but, over the fence, if you will, of someone coming by and saying that. It happens in letters, and then I send notes back. So it does happen. And again, I'm not calling folks. I try and make sure I honor folks' personal space on this and in these tragedies, but more and more people are bringing it up. And I have to tell you, for me personally, to see folks in that loss, it makes me ask the question to myself, what more can I do? What more should I have done? And I think for Minnesotans, once you see someone who's had this, these are just heartbreaking stories. And I get it, that it seems hard to imagine that, what you've been told was a flu or something, that this is happening. It's not. And it is, we don't know genetically at this point. We don't know the pre-existing. And as Jan always says, we don't know what the long-term damage is going to be. But it does happen, and it's painful. And I feel and own the sense of responsibility. It is my job to do all I can to make those avoidable deaths as rare as we possibly can.
Thank you. Your next question comes from the line of Kris from KR11. Your line is open.
Thank you very much for taking the call. I appreciate it. Hey, I'm not sure how much information you can give on this, but you said somebody in their 20s passed away with no underlying health issues. Is there any more information you can give us on that particular person or circumstance, as it's clearly an outlier? Go ahead.
Yeah, I'll defer to Jan. I have to be very careful. Jan is very, very disciplined on HIPAA and personal health requirements. I don't think I crossed that line, Jan, but if there's anything more you can give.
No, thanks, Governor. No, we're not able to share any additional details on that. We wanted to note it just because it is not typical, but we need people to understand that just younger age and even health condition is not a guarantee that folks are not very vulnerable. This is a tragic outcome, and our hearts go out to this and all families.
Okay, thank you. And if I may follow up real quick on a different topic, this is one that's starting to hit workplaces around the country as the virus spreads so much. There's a CDC standard of considering close contact with somebody is 6 feet of being within 6 feet for 15 minutes. Yet we've seen the virus spread in churches or in buildings or in areas where people aren't within 6 feet for 15 minutes. Yet those are the guidelines that a lot of companies are using for human resources and contact tracing within companies. Dr. Osterholm, perhaps maybe this is for you. Can you talk about what the latest science says about transmission and how long you have to be near somebody, and what risk factors are there that we know about?
Well, thank you. This is an evolving area, and our group actually happens to be quite involved with it. Remember that the way you get infected in this regard is, in a sense, what I call swapping air with someone. When you're in a room and someone's smoking a cigarette, you obviously can smell it throughout that entire room. If you're walking in the street, you can smell it, even if they're 40 feet ahead of you. Same thing is true with perfume, etc. That's what is being caused by an aerosol, very, very small, tiny particles that basically float in the air. If you look at the sun through your window in the wintertime in particular, you can see dust floating in the air. Those are aerosols. And we now know, and the CDC has acknowledged this, that in fact aerosols do play an important role in the transmission of this virus. And so is the 6-foot area around someone the zone of most likely to get infected? Surely it is, but it surely isn't the ending at 6 feet. It doesn't end there. And so we know that this is a concern. As far as how much air you need to get infected, it's dependent on time and the amount that's in the air. And so that, I can't give you an answer because each one is a little bit different. But one of the things when we see super spreading events, that's somebody who's transmitting the virus and they're in an environment where they may be crowded in one room or in a single space indoors, riding in the same cars, etc. And that really is, again, a function of time, dose in the air, and amount of air you breathe in. So, yes, we are seeing more and more of this transmission, well documented, and I wish I could tell you there was an absolute answer at this distance or that distance not. I can feel quite confident in being outdoors 10 to 20 feet away. The risk of becoming infected with or without your mask on at that point, if you're outdoors, is very, very, very low. That same kind of contact indoors at a closer distance without a mask would be very concerning. So I think that hopefully gives you some sense of the relative transmission. And, I wish I could give you exact feet away, and that doesn't exist.
Thank you. Appreciate it.
Thank you. Your next question comes from the line of Theo Keith from Fox 9. Your line is open.
Hi, Governor. You mentioned earlier on this call that there were going to be some more mitigation efforts coming, and as I understand it, there may be some more modest restrictions announced next week. One of the criticisms this week was that restaurant and bar owners got very little heads up before you announced the restrictions on Tuesday that are happening tonight. Do you mind telling us, and more importantly them, what you've got in mind next?
Sure, and I would just say, Theo, we do our best to have countless outreach conversations with folks. We were just noted today, and I'm grateful for this and proud of this. Minnesota's data and forward-facing data was deemed the best of any of the 50 states. I can't imagine there was someone out there that was not seeing that there was data supporting the direction we're going. But I will continue to try and work because I know how painful this is with folks. I think what you can do if you're looking at data and you're wondering, what moves are going to be made, we're looking at who's most likely getting infected here, where are they getting infected, and when, and how can we make changes to that. And if you look, we put out a lot of that information. We know that 71% of the infection rates were coming from the areas of social gatherings at homes, or in this case, bars and restaurants, and that's why we put that out. So we continue to try and talk to folks. We continue to try and move. This is moving so rapidly, and we knew this would happen, that we are trying to give as much lead time as we possibly can. But it's also very difficult to do that because this data is coming in waves right now. And again, just that statistic, 27 weeks to reach 100,000, 7 weeks to reach 200,000, 3 weeks to reach 100,000. You do the math. Week and a half to reach, if Mike's numbers are correct, which I have no reason to believe they're not because he's been accurate through the whole thing, then we're at a week and a half. So I think what you need to look at those types of places where people are gathering close together, indoors, with close contact for extended period of time. And you could probably extrapolate from that how we're looking at this.
And just so we're clear with the people out there, what after this curfew goes into effect and the limits on private gatherings goes into effect tonight, what are you looking at next? What restriction might be next?
Well, we have not determined that yet. I think it goes to, again, where you can see we've certainly had a lot of conversations around trying to, gather folks back for sporting events and those types of things. That makes it very difficult because they're close together. And so I think we're continuing to try and see where this evolves. And one of the things I keep telling people is if you want to see a change to the restrictions, again, the biggest change we could get to the restrictions is upping our mask compliance, doing our social distancing, getting tested, and isolating. So we're still trying, and that time compression makes it very difficult. In an ideal world, we would try these. We would go through 1 or 2 quarantine periods, which would either be 14 to 28 days, and we would see if we had an effect with what we did. The problem is it's moving so quickly, we're going to have to make some decisions sooner than that. So at this time, I can't give you a specific, but I think it's clear that at this point with this infection rate, indoor activities of large numbers, especially 18 to 35-year-olds, are certainly areas of concern.
Okay, thank you.
Thank you. Your next question comes from the line of Marielle Mose from WCCO-TV. Your line is open.
Hi. My question was just asked. But I guess while I have the floor, Commissioner Malcolm, I want to ask you, I have a lot of people I know who have tested positive for COVID who have lost their sense of taste and smell. And despite quarantining for 14 days and actually feeling a lot better and recovering, they're still not getting their senses back. And some people telling me they have lost it for months at a time. I know all bodies are reacting differently to this virus, but any idea of why this is happening and when people are going to get their senses back, if at all?
Well, I think this is a good example of what we've been saying, that the effects of this virus on people who may not even have what they consider to be very severe bouts of illness can be long-lasting and puzzling, and other phenomena can appear weeks or longer down the way. I'm going to Kris Ehresmann's on the line too, and Dr. Osterholm. So I'm not a clinician myself. Mike or Kris, I don't know if you have anything specifically on that particular symptom.
No, I mean, we know that everyone responds differently. So for some people, they have, a resumption of taste and smell with their symptoms. And then for others, it does last much longer. But as the commissioner said, I mean, some people will be what they're referring to as long haulers with this, and we just don't know who those people are. And no one knows if that's who you will be. So that's why we're encouraging people to take this very seriously. But I'll offer it to Dr. Osterholm if he has a comment.
No, I think you covered it. I mean, we're still really exploring the long-term effects of this. I keep referring back to the long haulers condition as a very important reason why young, healthy adults don't want to get this virus. Even if they don't think they're not going to end up in a hospital or an intensive care unit, we're seeing up to 25% of individuals who have mild illness at first, who by weeks 5 or 6 post-infection are actually in many cases experiencing very severe chronic fatigue-like symptoms, experiencing what they call a brain fog, and in many cases are basically disabled at home. I know of such cases who are literally on 100% oxygen after having had a mild illness. So again, this is one more reason why you don't want to get infected with this virus.
Operator, we have time for one more question today.
Thank you. Your next question comes from the line of Brandy Powell from KSTP Channel 5. Your line is open.
Thank you. Hi, Governor. I'm wondering, this morning I was with the Minnesota Nurses Association. They were talking about the jobs that will be lost, their anger about hospitals either shutting down or decreasing or changing the roles of various nurses. The president of the association was saying that she wants the state to do something more to stop hospital closings from happening. I'm wondering, is there anything that you have the authority to do, or do you have any comment about these changes, specifically with mHealth Fairview?
Yeah, I'm going to echo, and you heard this from Mike and Jan both. Mary Turner is one of those heroes. She's an emergency room RN. She also speaks eloquently and passionately for the thousands of nurses who at any time is a critical job, but now being placed in the situation they are. It was Mary Turner and the nurses that were pushing early on for PPE, making sure they wouldn't have to reuse masks. They were there to help us support pushed testing amongst healthcare workers. And I think this issue of hospitals and the hospital strain that they're having, consolidation in healthcare was an issue pre-COVID. It is still there now. And the ability to move staff around. And what Mary's talking about is how are folks going to be moved from one place to another if we need this. So they are critical partners with us on this. I remind people that in America, our hospitals are independent, privately run enterprises. Just like other things, there are regulations in place, but the state has limited roles, granted a little broader because of public health care concerns, but these are conversations that we're having. And I want to acknowledge and name that these nurses are under immense strain on numerous fronts. They see hospital closings and movements happen in the midst of this, and it is both scary and terrifying for them in terms of care for their patients. It's both disconcerting to them for their own professional growth. So we have a lot of discussions in this country about the future of healthcare. It is not going to be any different here in Minnesota, and we are having these conversations. But I think it first goes to point that when the nurses are speaking about this, these are real issues, and we're going to have to there will be realignment when this is over. I witnessed it as a member of Congress in the 1st District with the closing of the Albert Lee Hospital. These are never easy, but in COVID, they're even more difficult.
And I think with that, we'll have to conclude today's call. Thank you, everybody, for joining.
Thank you, everyone. Dr. Osterholm and Commissioner Malcolm, thank you. Thank you, reporters.
Thank you.
Thank you, speakers. Ladies and gentlemen, this concludes today's conference call. Thank you all for joining. You may now disconnect. 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 You may now disconnect.